First, we would like to understand that how this drone is going to bring a revolution in the medical sector. What all services do you provide, and how the private player is using this drone technology?
So we are into drone delivery as a service, and we have been working with clients like Flipkart, Dunzo, Blue Dart, now Redcliffe as well. Drone is going to bring a big revolution altogether into the entire industry, and drone delivery ecosystem at large is going to contribute to this global goal that we have got to make India a global drone hub by 2030. Now, drone delivery is going to make things much easier for a lot of sectors that we are working in, especially healthcare and diagnostics, reducing the time that it takes currently for any logistics to happen in this country by saving lives to a larger extent as well. On top of that, not only this, but it's going to be very cost effective in the years to come. Today, drone delivery technology is creating revolution in terms of saving lives and time. And tomorrow, with this sort of scale that we are expecting in this industry in the next 1.5 years, this is going to bring down the cost of logistics, even to match up the cost of conventional logistics which happens today in this country.
What we are witnessing, this blood sample being taken to a laboratory. Okay, so explain us that how this entire process is taking place, in the sense that what is the carrying capacity, what range it can travel, this drone can travel, and all the basic details.
Sure. So this drone can carry a payload of 5 kgs. This has also got integrated cold chain system with it. If there is a sample which is required to be maintained within a cold chain system of 2 to 8 degrees, we have boxes which can carry that. This can contain 50 diagnostic samples that we can carry in one go with cold chain into place. Without cold chain, we can carry 100 diagnostic samples from one location to the other location. The range that this drone can cover is between 15 to 20 kilometers. Today we are doing these flights between 15 kilometer aerial distance. By road, that distance is almost twice of the aerial distance. So when we are delivering from A to B at 15 kilometer, by road it is approximately 32 kilometers, which saves a lot of time that it currently takes place at the collection center to bring up the diagnostic samples to the labs. And even in the future, and even in talking about the hard to reach and hilly terrains, this is going to prove to be a big boon altogether in saving mankind and uplifting and giving more better economics to the healthcare sector eventually.
The challenge part, like before taking off this drone, what all tests or checks that you do, and what all hurdles are there for any drone technology to operate?
So safety and security is paramount, in whatever technologies we try to push and we try to get into the aviation with. We work on the principle of making sure that every single delivery that we do, that is the safety is taken as almost as a primary concern in all categories that we do, and that is where we carry and we do multiple safety levels. We do multiple safety checks and balances in order to make sure the flight is all safe. We do manual recce for ensuring that the entire flight plan is obstacle free and to navigate through difficult terrains in a way that the package as well as the drone lands and takes off very safely in those conditions altogether.
One last thing, would like to understand that so far, with how many state governments you have done, whether it be an agreement or you are in talks with?
So we have recently got into a collaboration with the government of Himachal Pradesh. We have done trials in Dharamshala, and after that we have done trials in Chamba district as well. We are looking forward to collaborate more with different other state governments to enable medical corridor deliveries into the state, as well as take it to the agri products, because agriculture is a greater industry which is now taking shape. We recently did the first agri commodity delivery in Meghalaya, and we are now looking at collaborating with states to do agri product deliveries, also enabling farmers to a much larger market altogether to grow for.
Thank you, sir.
Thank you.